Dr. Quinn, have some of your patients had this surgery, and what were their experiences?
Jade, you would not believe it. And ironically, I had a patient yesterday to come in about 4.5 months after his surgery. Now, when I walked in the room, I didn't even recognize him. He looked so different. His face was more thin. He was much, less heavy, and he had on some really nice clothes. I was like, man, you're GQ. The bottom line is he had high blood pressure. He had diabetes. He had elevated cholesterol. He was being treated on medication for all of these problems. And on yesterday, it was determined he no longer needed the medication. He went from 285 pounds, all the way down to 212 pounds in only 4.5 months. I was like, oh my goodness. But to put just the silver lining on top, he told me that his relationship was much better. He's happier now. And he was going to ask his significant other to consider him for marriage on next week.
Oh, wow. Well, many are concerned, though, Dr. Quinn, that the surgery is risky. Is it safe?
Well, anytime you participate in a surgical procedure, there are always risks. But what we as healthcare providers do is we look at the risk versus the benefits. Now, the good news about weight loss surgery is the risk profile is actually very low. It's much lower than what people think. It's actually considered very comparative to getting a cholecystectomy. That's just getting your gallbladder taken out, a very low risk procedure. But the good news is the weight loss surgery is very similar, very low risk profile, because it's an elective procedure. So before they do the surgery, they have time to make sure you are safe for the surgery. It's a laparoscopic protocol that is the safer. But as far as the benefits, we talked about the risks, which are low. The benefits are phenomenal, because individuals that have this surgery, they lose that weight. There's less of a chance of them having a heart attack, a stroke, diabetes, kidney disease, and so on and so on. So the surgery is phenomenal.
Do you recommend this type of surgery to your patients who may be struggling with their weight?
I do. I mean, now, as a family physician, we're first going to try lifestyle modifications. We're going to try diet. We're going to try exercise. For some, we even do medications that help individuals lose weight. But then there are a population of patients that have significant weight, and they've done everything they could, and they just could not get the results that they deserve. For those individuals, after we've exhausted the other options, then we'll try the surgery. And overwhelmingly, every patient over 18 years has had phenomenal results, and that's the take home, just helping our patients get better.
Absolutely. Well, thank you so much, Dr. Quinn, and we'll be right back.